Hello everyone, this is Kashma Gupta, rule number 33, and I will explain about anti-diuretics. Vasopressin, it is a peptide hormone synthesized in the supraoptic and paraventricular nuclei of the hypothalamus and stored in the posterior pituitary. Its actions are via first V1 receptor, V1A mediated. It causes blood vessel vasoconstriction. In GIT, increases peristalsis. In liver, glycogenolysis and platelet segregation. V1B mediated, it causes release of ACTH from anterior pituitary. At V2 receptors, it increases water reabsorption in renal tubules, hence reduces urinary output. Vascular endothelium, it causes release of clotting factor 8 and von Willebrand factor. In uterus, contraction of the smooth muscles by vasopressin is mediated through oxytocin receptors. Both V1 and V2 are G protein coupled receptors. Vasopressin analogues. These are desmopressin, lipressin, and terlipressin. Desmopressin, it is selective V2 receptor agonist and is more potent than vasopressin as an antidiuretic. It has negligible vasoconstrictor action. It is administered by oral, nasal, and parenteral routes. Lipressin, it acts on both V1 and V2 receptors. It is less potent but more longer acting than vasopressin. It is administered parenterally. Terlipressin, it is prodrug of vasopressin with selective V1 action. It is administered intravenously. Uses of vasopressin analogues. First, due to V1 receptor mediated actions. It is used for emergency control of bleeding of oesophageal varices. Terlipressin is preferred over vasopressin because it is safer. It constricts mesenteric blood vessels, thereby decreases blood flow to portal vessels and reduces pressure in the varices, thereby stops bleeding. Vasopressin may be used before abdominal radiography to expel intestinal gas. Second, due to V2 receptor mediated actions. Desmopressin is drug of choice for central diabetes insipidus. It is not effective in nephrogenic diabetes insipidus. Desmopressin is administered intravenously in hemophilia and von Willebrand disease. It controls bleeding by promoting release of factor 8 and von Willebrand factor. Administration of desmopressin at bedtime reduces nocturnal urine volume. Diabetes insipidus. It is a condition characterized by excretion of large volume of dilute urine either due to decreased secretion of ADH from neurohypophysis or due to inadequate renal tubular response of ADH. So there are two types of diabetes insipidus: the central diabetes insipidus and nephrogenic diabetes insipidus. Central diabetic insipidus, there is decreased ADH secretion. The drug of choice is desmopressin, route intranasal, oral, subcutaneous or IV. Duration of therapy usually lifelong. Desmopressin has more selective action on V2 receptor, hence preferred in central DI. Its action on V2 receptor in the cells of collecting duct results in the decrease in urine volume. Chlorpropamide, it is oral antidiabetic, increases antidiuretic effect of ADH on kidney. Carbamazepine, antiepileptic, decreases urine volume in high doses. Thiazides are also useful in central DI as they decrease urine volume. Nephrogenic diabetes insipidus. In this, ADH levels are normal, but renal tubules fail to respond to ADH. The drug of choice is thiazides. Thiazides probably act by depleting sodium and ECF volume, which results in compensatory increase in proximal tubular reabsorption of sodium and water, leading to decrease in urine volume. Moreover, action of thiazides in early distal tubule results in the formation of less dilute urine. Amiloride is preferred drug for lithium-induced nephrogenic DI. Indomethacin reduces urine volume in nephrogenic DI by inhibiting renal prostaglandin synthesis. Adverse effect of vasopressin analogs. It causes nausea, vomiting, diarrhea, belching, and abdominal cramps. Backache is due to uterine contraction. Vasopressin can precipitate an attack of angina by constricting coronary blood vessels. Hence, it is contraindicated in patients with hypertension and coronary artery disease. Intranasal administration of desmopressin may cause local irritation and ulceration. Fluid retention and hyponatremia can occur. It should not be given to patients with acute renal failure. Syndrome of inappropriate antidiuretic hormone secretion. In SIADH, there is impaired water excretion along with hyponatremia and low plasma osmolality due to inappropriate ADH secretion. The conditions that may be associated with SIADH are head injury, meningitis, brain tumor, pulmonary diseases, etc. The signs and symptoms include anorexia, nausea, vomiting, muscle cramps, lethargy, coma, convulsions, and even death. Treatment includes restricted water intake, drugs. Demeclocycline is useful in the treatment of SIADH. It inhibits the action of ADH in the collecting duct. Vasopressin receptor antagonists like conivaptan and tolvaptan are useful in the treatment of SIADH. They are non-peptides which are administered intravenously and orally, respectively.